For the follow-up of a patient with sickle cell, you have to follow up the disease, the cause, the complication, the background, and you have to follow up with respect of clinical and paraclinical means. I've already explained you how you need to follow up. For the disease which is sickle cell, I've said there's nothing on it. You have to follow up for the crisis, how the patient presented. If he presented with pain, you have to evaluate for the pain ladder per day. Is it clear? By this, a scale of 0 to 10. Is it clear? It can be visual analog or it can be verbal numerical scale that you have to evaluate. You evaluate paraclinically for all these elements. For the sequestration spine, you can evaluate for the splenomegaly with Hackett's classification. Is it clear? Clinically and paraclinically, you can visualize with the ultrasound. So those are the different elements that you have to you to progress with. You visualize for the complication clinically and paraclinically. Is it clear? And then you visualize for the cause. That's a precipitating factor clinically and paraclinically. If the patient is rehydrated, if the urine output, you visualize for the hypoxemia, the saturation per day, and all those elements. Is it clear? And you have to prevent the patient from coming to the hospital, prevent the reoccurrence. And how do you prevent the patient from coming to the hospital? You have to counsel the patient that he should prevent the precipitating factor. You have to counsel for vaccination. Is it clear? You have to counsel for vaccination, and the vaccines are for pneumo 13. You have pneumo 23 vaccine, which is given every 3 years, and you have the meningo vaccine, ACYW, or you have the AC or you have the YW that can be given to the patient. Is it clear? It can be given every 1 year to 3 years. Is it clear? You have the typhoon vaccine that can be given to the patient, typhoon V vaccine that can be given to the patient. All is going to prevent the reoccurrence, because these are microorganisms that are going to be complication of the sickle cell, and they can also be the precipitating factors of the sickle cell. So those are the different things that you have to tell the patient. You have to also tell him to comply on the folic acid that is supposed to be taken every day. And you need to know that no iron is given to the patient, is it clear, except that there is an evidence of iron deficiency anemia. And to show that there is an evidence of iron deficiency anemia, you must have a microcytic hypochromic anemia, and then on full blood count, and then you must do a serum iron profile where you see the serum iron is going to be low, the ferritin is low, and then the transferrin is low. So all of them are low before you can say there is an iron deficiency anemia, before you give iron to the patient. Generally, in patients with sickle cell, they don't need iron because they have iron stores. Is it clear? So those are the different things that you have to note. So from here, and also they are always going to be transfused, so they have iron in those red blood cells. So from here, we are finished with tutorial on sickle cell. So we can say thank you, and don't forget to like and subscribe for our channel, SchrDbb. Thank you.